So here's where theory comes to practice. As a public health professional, I educate my students as I learned that you have to be your own advocate, that no one is an expert of your body except you. You are a partner with your provider on how to take care of you and how you can get to optimal health. You're a partner. This has very much rung true for me since this diagnosis. I really saw and see firsthand how the healthcare system leaves a lot to be desired. From the moment I got my diagnosis to going through different providers, to journeying to getting labs done, it has been an experience so far. Number one, I'm grateful for research and also advancement in healthcare, where we have what you call patient navigators. Not having them here is showing me the importance of them. Just understanding, first of all, how to open a portal to where you can access your medical records. Just understanding how to get around at the clinic. Understanding resources that are available for you. That's where you see the importance of case managers. Knowing what can be available for you, for instance, like support groups. All of that is important. I haven't gotten that, and that's why I'm seeing the need for it. I've had to advocate for myself. And, I said, one of the things I said was to learn what God wants me to learn in this experience. And one of them is that I have a voice that matters. And what is wrong is wrong. If I see it as wrong, I should vocalize it. If it is right, also, same thing. Just validating my feelings and my lived experiences. To give you an example, I'm not talking any more code. I saw a surgeon from a different place, a different agency, and I'm also receiving treatment at a different agency. When I was initially diagnosed, they said it was stage 2A. Now I have done research. In fact, I got diagnosed the week that I was teaching my students about cancer. I was supposed to teach about breast cancer the day after my diagnosis. Of course, I had to cancel the class. I needed to process some things, but I'm diverting. So I know what abnormal breast looks like. I had the orange pill look, and I shared that with my husband. And so I also brought it up with my surgeon, and he said that could be edema because, of course, the cancer has been found in my lymph nodes, in my axillary lymph nodes. But I still asked, and I'm grateful he also took the initiative to do a punch biopsy of the skin of the breast, and they found out that indeed it is in the skin. So it's now stage 3. I say all this to say that that new updated diagnosis is not in my current patient portal. And so it concerned me because I'm wondering, will that impact the type of treatment I'm getting? Thankfully, it doesn't. But still, I need that documentation to be in this portal so that they have a holistic view of my health. They have all my documents in one central location. So I grieved that today. I gave that as a grievance when I was talking to the nurse practitioner. They say they'll change that. They also didn't. I sought a second opinion with another prominent cancer center here. And in the pathology report, they show that the tumor has some estrogen, a percentage, I believe about 15% of estrogen. So it's estrogen positive by that percentage. Sadly, the oncologist that I met at that other center didn't tell me this. I saw this when I was looking at my records because I was looking at my results from my bone scan. So I'm here waiting for my next infusion, trying to understand what all of this means. Does that mean they change my treatment? Will I need to get on like tamoxifen, for instance, and take, hormone therapy because it's estrogen positive, one of the tumors? But there was no discussion of that. So I brought that up as a grievance, and they explained that because it's negligible percentage, it's a small percentage, the treatment remains the same right now, and they'll be monitoring. That would have been good to know. So that's why I said sometimes it's a good thing, it's a bad thing. It's good we have access to our healthcare records, but it's also bad because we don't have someone to explain it to us in the moment. So imagine the level of anxiety that comes with opening up your labs and seeing your numbers all over the place, for instance, or looking at some certain terms like a hemangioma or hemangiotoma, and you don't know what that means. Thankfully for Dr. Google. But it is very important to understand the power of speaking up, health literacy, knowing what is not right. For instance, when I finished my treatment, I, didn't say anything, just said, okay, you're done. I don't know what to expect. I don't know what days will be the worst on average. I know everyone's different, but all of that was not explained to me. It's frustrating because I had to learn through a fellow survivor who's my neighbor and friend. She's the one who said, okay, by day 7, day 8, you will be feeling